Okay, I will leave you with Mr. Domenico. Andrea, thank you very, very much for your patience. I will give you the floor, and then we'll take some questions.
Thank you. Thank you very much. Good afternoon to everybody. As you said, Stefan, earlier, the mood of the teams on the ground on Saturday was more focusing on the potential agreement for a ceasefire, and then we woke up on Sunday with initial rockets shot at Karen Shalom that have precipitated the situation in Gaza. The most recent evacuation order issued by Israeli authority, of course, are linked to the military operation that have been triggered since then, have resulted in the forced displacement of tens of thousands of people, many of whom have already been displaced multiple times. We could not yet count how many people have moved. We have been out on the ground just monitoring some areas, and we saw 200 families per hour moving, but it's a little bit difficult to go beyond and give a precise number at the moment. The closure of Rafah crossing has severed access to fuel for humanitarian activities, the entry of critical humanitarian items, and curtailed the movement of staff. Protection of civilians for us remain essential, of course, as it is humanitarian asset and supplies, and we are seeking assurances from all parties to the conflict that they should help us to protect those and ensure respect of civilians. We continue to advocate for concrete assurances and actionable measures to facilitate the safe and secure movement of humanitarian cargoes via all routes into and within the Gaza Strip. On fuel in particular, as you can imagine, humanitarian operation cannot run without fuel, as simple as this. So unless the supply of fuel resumes, all the humanitarian communication and banking services will halt completely in a matter of days. The lack of fuel will affect life-critical sector across the Strip. We have done we've looked at how many liters we have as of now. We have 30,000 more or less liter of diesel, and those are what is remaining as of tonight accessible for distribution to humanitarian actors. The stocks at Rafah crossing fuel station and in Khan Yunis are currently not accessible due to the security situation prevailing on the ground. Communication companies are unable to receive the daily quantities of fuel required to sustain their network, and this means that as of in a couple of days, people will not have access to information. We will not be able to gather information for people to understand their needs, and families will not be able to connect during displacement if they get separated. Over 75% of the population in Gaza so far has been displaced, as you know, and the population left inside might now have no option but to remain in a ever-decreasing area of land. We always remind the parties that all civilians should be able to flee the areas to seek safety. The site to which people are displacing are without latrines, without water points, without drainage, without shelter. And it is impossible to improve the situation in the existing and the new displacement site without the entry of supplies and without the fuel to transport them to the location where the people are concentrating. As of today, shelter partners have 1,500 tents at hand. And the lack of tents combined with the 70% of housing damaged or destroyed, IDPs living Rafah are forced to find other options. And they need shelter materials such tarpaulins, ropes, plastic shelter, nails. And those tools are simply not available in Gaza. And without the humanitarian assistance that will bring those in, we will not be able to support them. Most of the food dispatch and distribution in the south have been suspended since yesterday. as partner-made warehouses are in the Rafah, in the part of Rafah that has been affected by hostilities. It is estimated that most of the partners will run out of food stock to support people in the south of Wadi Gaza by the end of the week. Partners are running out of fuel to dispatch the remaining commodities for distribution to households and supporting the bakeries. Without additional fuel, all the food assistance will be impacted, including the 16 bakeries supported by World Food Programs and humanitarian partners that will be forced to suspend their operations. If nutrition supplies cannot be accessed due to the crossing closure, treatment of more than 3,000 children with acute malnutrition will be interrupted, as it will be the case for routine service delivery, like screening, case detection, referral, and blanket supplementary feeding. Health will be impacted by the increased military activities in Rafah, and we unfortunately expect that three of the main hospitals the three remaining hospitals in Rafah will become inoperable in the coming hours if the operations continue, depriving 1.2 million people of healthcare. Pregnant women have no options for safe delivery for their babies. That will be where we will be if this is happening. And WHO has also alerted us that there is a shortage of vaccine for routine immunization, which have been, as you may imagine, very much disrupted in the last 7 months. In terms of WASH, I think that we have faced a chronically poor access to water and sanitation services that have contributed to presence of disease and increasing malnutrition. Without fuel, tomorrow the main water production will be shut down in the north, depriving the entire population of access to drinking water. And the same will be in another day for the entire south, operation in the south and in the middle governorates, which will be impacting 1.9 million people. The risk of long-term losses of assets and water production is also something that colleagues from the water expert are alerting us about, because the lack of use of material and assets will result in irreparable damages to water membranes and other wash assets. And those same assets that have been systematically and consistently denied entry in the last 7 months. We have a huge issue of solid waste collection. The collection site and the neighborhood the neighborhoods and the collective collection points in South Gaza have already been reduced and fully seized without fuel, of course. We estimated there will be a production of 1,400 tons of waste per day that will accumulate in the strips all over. And this was already a big challenge because also we do not have access yet to the landfill where we could deliver and drop all the garbages. As of today, Al Junaina sewage pumping station in East Rafah has already stopped working due to the military operation, and this will impact 80,000 people. Sustaining the border closure will deprive more than 690,000 girls and women of their dignity and access to hygiene services and supplies. This is something that colleagues from the protection cluster have raised consistently, and this has been particularly challenging for all the humanitarian community. The number of unaccompanied and separated children will rapidly increase, while our ability to provide them basic support will be heavily reduced if the situation in Rafah evolves with further military operation. The only shelter for unaccompanied and separated children will be relocated in Deir Balah, but that has a minimum capacity, and this will limit the opportunity for the newly identified children to receive residential care. The massive displacement of the population in Gaza has deprived children of safety and a place to learn since 7 months. This further limitation of humanitarian aid will deprive over 625,000 children of school and will put them at risk of permanently dropping out of school, rendering them vulnerable to exploitation, child labor, early marriages, and other form of abuse. The reality is that we are confronting a situation where we have probably one of the least resilient population in Gaza because of the 7 months of war, in one of the most violent and lethal conflict that we have seen in the recent years. And we are at risk of having no humanitarian assistance available for those in the coming days if we do not find alternative way to bring in and sustain humanitarian assistance. I'm happy to answer any question. Thank you, Stefan.
Much, Mr. De Domenico. I'll just turn the floor over to questions. First question goes to Edie Lederer.
Thank you very much on behalf of the United Nations Correspondents Association for doing this briefing. My name is Edith Lederer from the Associated Press. You said food's going to run out in a week. The 30,000 liters of diesel that you have left, could you tell us, is that in the south, is it in the north, and when do you expect that to run out? And have you gotten any indication from the Israelis of how long they're planning to keep Rafah and Kerem Shalom closed?
Thank you for the question, Ita. We normally use 200,000 liters a day, and we have actually asked recently to increase that quota because we were hoping to expand our operations. So when we speak about 30,000 liters in hand, it means that we are really scratching the barrel of our ability to operate. Today, the team have done a prioritization of the limited amount of fuel, targeting some specific facilities. Health was prioritized, water, some communication, and we took some aside for contingency for security movement of the staff, basically. That will leave us basically with no fuel as of tomorrow. The Israeli have provided assurances that they are working out a way to bring in more fuel, and they're hoping to be able to organize this tomorrow. We will see. The reality is that there will be then a second challenge that once the fuel is in, is also to distribute it around, because if Rafah is caught in the middle of the operations, military operation, as you can imagine, it's very difficult to operate and move around with tanks full of fuel. And as long as the length of the operations or the closure of Kerem Shalom, they told us that they hope to reopen rapidly, but they did not put a timeline precise on that.
Okay, thank you. Ibtisam?
Thank you. My name is Ibtisam Azim, Al Arabi Al Jadid newspaper. I have first a quick follow-up regarding the operation, whether you were informed, whether the Israelis informed you before the beginning of the operation. And then my question is about northern Gaza and the famine situation there, if you could elaborate, and if you see similar situation in other areas. Thank you.
Thank you, Dissam. We have been speaking with the Israeli about the possible implication of an operation in the south of the Gaza Strip since, as you can imagine, since a couple of months, given the trajectory. And we were trying to be ready, and we were trying to discuss with them how eventually we could adapt and make sure that we sustain humanitarian assistance. As I said, Saturday night we were thinking to increase the staff footprint in Gaza in order to deal with the potential expansion of operation offered by a ceasefire. And then Sunday we've been brutally brought back to reality by events. And in the afternoon of Sunday, we received communications that we were invited to stay out of harm's risk. And then when we follow up with the Israeli military, they told us that they start circumscribing a little bit the area that was more at risk. And then on Monday morning, as you have seen yourself, I guess the evacuation order were issued. That is a clear indication of where you could expect military operations. So we are constantly in contact with the Israeli authorities. We're trying really to agree on maintaining the space for humanitarian assistance and trying to find ways to sustain our operations. So the dialogue is constant, and I hope that it will bring some positive, step forward in the hours to come. In terms of the famine, of course, it is very worrisome. It was particularly worrisome in the north, as you have all seen in the IPC report that was published. And there was an initial positive, a series of positive steps have been taken by the Israeli to allow to increase the number of assistance coming in. The challenge remained the internal distribution, which is still very, very problematic. And we keep on engaging with the Israeli on this. But now with the new situations, we are confronted to the risk that not only we will not be able to deal with the impending risk of a famine in the north, but also, if you remember the APC, there was a very concerning numbers also from the south. So for us, the interruption of humanitarian assistance means that the risk of famine is spreading not only into the north with imminency, as it was announced by the APC expert, but also potentially to the south.
Ephraim?
Thank you so much. Mr. Domenico, I wonder if you have any more information on what is happening at the Najjar hospital. We are reading reports that the Israeli forces have ordered evacuation of patients, of paramedics, and of families and refugees who are taking shelter there. Do you have more information on what is happening right now? And our understanding is this is one of the remaining two partially functioning hospitals. What's happening to the other one as well? Thank you.
So I do not have specific information, but unfortunately, I have to say that this is following the patterns that we have seen in previous operations done in Gaza City or in Khan Yunis, where when the military operation approaches the areas where there are hospitals, the Israeli army requires the evacuation of hospitals. For us, we have maintained that hospitals should be a sanctuary and protected. They benefit of special protection under international humanitarian law, and all the parties, I repeat, all the parties should respect the neutrality of hospitals. It is very concerning because that means that we will further reduce the ability of the health systems to respond and to the reality is that the health system and the hospitals in particular are really put it on their knees. If we lose the hospitals, all the three hospitals available in Rafah, it will be simply a disaster. There has been an effort to start field hospitals, but any doctors will tell you those will not be able to cater for the entire breadth of needs of 1.9 million people. And so for us, again and again, we repeat and we plead the parties to respect the hospitals and maintain the hospital functioning as much as possible.
Thanks. Nabil?
Thank you, Nabil Abisab, Al Arabi TV station. Do you have any information about the pier that maybe the U.S. is about to establish? It seems that they have new plans or updated plans to relocate it to the Israeli side. Is this coordinated with you? Do you have any information about it?
So thank you, Nabil. I've not heard about any relocation. What happened, I think that the American army were building the pier, and then there was the sea conditions deteriorated, and so they had to move it toward Ashdod, and then they plan to bring it back. We have engaged, of course, with the Americans, and heavily on the discussions and trying to find a way to better facilitate and seize this opportunity that will potentially bring an additional corridor for entry of goods. And of course, we are trying to tease out and understand how and when this will start. I think there were an attempt to start by the 9th of May, but I do not have the planning under my control. Having said that, we keep on saying over and over again that not the pier or any other solution that has been used so far cannot and should not be seen as a replacement of the land route. Land routes are the most efficient, the most effective, and the only one that will allow the system to go up to scale. The humanitarian system and the commercial activities, because those will be the only way out to serve 2.2 million people in Gaza.
May I have another question, please, quickly?
Sure.
Yeah, also speaking about the cross-border crossing points, it seems that a Jordanian convoy was attacked, or at least this is what Jordanians are saying. It was attacked by settlers today before reaching Erez crossing. Are these convoys coordinated with OCHA, and do you expect more of them to come from the north?
So those convoys are coordinating with the United Nations system. Actually, the USG CAD mechanism is also part of the facilitation that this convoy should benefit. We have seen cases in which trucks have been indeed blocked and attacked by settlers. I think that the Jordanian, as Stefan was mentioning earlier before, the Jordanian have manifested their disappointment about those facts, and they've asked the Israeli authority to take care and make sure that humanitarian assistance and their convoys specifically are protected and can be brought directly to areas in safety. I think that it is important to consistently convey to all the public in Israel that it is humanitarian assistance that to civilians must be facilitated and must be respected. And I hope that the Israeli authority will also support the plea that we have made to protect those convoys.
Deji?
Yes, Mr. Domenico, Deji with China Central Television. I have a couple of questions. First, I want to confirm this. The Israeli embassy in China on 25th of April posted this. 5 million bread loaves and rolls are produced by 26 bakeries in Gaza every single day. Was that the situation? Is it now the situation? And based on the numbers provided by that piece, it seems the northern and mid Gaza, it's more. They produce more numbers of pita breads. How would you describe which situation is worse, the southern one or the northern one? And the third, we know that the border crossing of Rafah and the Karim Shalom has been, let's say, temporarily closed. But Israeli government used to say that they are going to opening Erez border crossing. Do you have any communication with the Israeli authorities on that part? Thank you.
So what I can tell you is that, as I mentioned earlier before, there are WFP has done a gigantic effort with UNRWA colleagues to ensure to support bakeries to produce bread. I don't know exactly the numbers, honestly. I will have to check with WFP colleagues. But I heard colleagues that they were saying that there were 3 pieces of pita bread available in the north, for example, a day potentially produced there. Now, what is important to understand is that pita will not solve famine. Let's be very clear about this. Famine can only be addressed in a combination of action that will cover health, water, sanitation, nutrition, and specific treatment for malnourished children, and food. And food in its diversity, because it's a diversification of the diet that is required. So while we are super satisfied of the fact that there has been an improvement in terms of the amount of flour that is entering into Gaza, and it's super important. We have to maintain it and expand it. But it cannot be seen as the magical solution that will address the looming conditions of famine in Gaza North. Comparing the situation is a very complicated question. I think that, I think that if you speak specifically about famine, yes, the situation in the north was much more problematic and concerning for us than the south. But of course, I think nowhere in Gaza as of today life is and so we should be mindful that the situation is absolutely catastrophic. There is no safety, and all the rest of the messages that we keep on trying to convey. The opening of Eretz, yes, I can confirm that there has been an initial opening of Eretz. The challenge that I foresee in the coming days is that, if you remember, we had gigantic challenges to serve the north from the south, and we were talking about 300,000 people. So I see also inversely super challenging for us the mere idea to be able to serve the south from the north as a unique entry point, particularly considering that we're 1.9 million people there. So what we keep on discussing with the Israeli authority is that we need absolutely to maintain the direct access to the north. It's important, it's a good step forward, and we have to consolidate that and expand that. But we also need to have access to the south. And I really hope that Karen Shalom could be reopened as soon as possible and allow humanitarian assistance to enter as soon as possible.
Maggie?
Hi, Andrea. Thank you so much for briefing us. It's Margaret Bashir from Voice of America. A couple follow-ups. I know that the United Nations is not participating in moving people, but these so-called safe humanitarian zones that the Israelis have set up, have you actually had any of your staff inspect them to see what kind of conditions are in them for the people that might move there? And what you said about the water lines shutting, I'm just a little confused what the reason is. It's strictly related to fuel, because I thought that Israel reopened like 3 lines, so wouldn't they be in charge of the fuel to open them, I guess is what I'm wondering. Thanks.
Thank you, Margaret. So for the water, the water in Gaza, so the Israelis have committed to reopen the line in the north, and they have reopened the Beni Suahila, which is in the middle area. That is, though, not sufficient to provide drinking water to all the population, particularly because when they opened the north, they realized that all the pipes were broken. And so there is a lot of work going on now in order to fix it, to fix those, because otherwise people will not receive water. And still, you can imagine with the heavy bombardment that has happened all over the Strip, it's nearly impossible to have the water going to the end point of distribution systematically across all the places. And so the fuel is the main obstacle for water production, as you pointed out, because it means that we have to go to use desalination plants, even mobile one, pump stations, and literally we have to pump water from underground, which has to be mixed with potable water because it's salted, as you know. So that's what basically provides water to Palestinians there, mixed with the water indeed that comes from the lines that are coming from Israel. But for example, there is no line that goes to Rafah, and linking back to the so-called safe zone, there is the entire zone that has been identified by the Israeli and called by the Israeli safe zone that we do not call safe zone because we keep on saying that there is no safe zone. When I was last time in Gaza, our guest house is along the coast, not far from the so-called safe zone, and there were targeted bombardment in the area. So there is not really a safe zone. So those areas have no pipes at all. There is no water. Is dunes of sand. So the only way out to bring water there is to either pump it from underground or bringing in the water. And of course, to bring water, you need the fuel to move the truck that moves the water, or donkeys, because donkey cart moving water is the reality today in Gaza. Our teams have been systematically visiting those sites, and not because they are considered the safe sites, but simply because they are the sites where people are concentrating and where we are trying to deliver services and assistance. And so this is where we keep on underlining the importance of maintaining humanitarian assistance and sustaining it through times, because what we see there, what we witness there, is a complete lack of basic services. There are no latrines, no water distribution points, no sewage drainage, and no medical facilities. We start seeing some NGOs that have established some primary healthcare points, but supplies of medicines and drugs is very complicated. So it's really very challenging for us to bring some minimal services to allow a dignified life in those conditions when we do not have access to full-scale humanitarian assistance. One example for everything. I've been discussing with women in Gaza that were telling us that they were not eating and drinking too much to avoid to go to the bathroom, because going to the bathroom in the dark is exposing them to danger of sexual assault or harassment. And we are not allowed to bring in solar lamps because they are considered by the Israeli a dual-use material.
Andrea, let me just get one thing clear. So Israel has set up these so-called humanitarian zones it's just land, or they've put tents? Because we had read reports they had ordered 40,000 tents or something. Have they supplied these areas with anything that would be sustainable, make life sustainable for people, or they're expecting the UN and other NGOs to take care of that? They're not providing any services to the people?
They are not directly providing services to the people. They're not present on the ground. What they have done is they have placed this order that you're referring at, and they are looking for partners that will eventually bring them in. So far, I think only 10,000 of the 40,000 tents that have been ordered have arrived. I have no idea where they are at the moment. I'm sure that the Israeli military will be able to answer you. But what I can tell you is that there are some sites that have been prepared by some partners that have engaged with initiatives to develop, anticipating, if you want, the potential move of people. But the way we are looking into this is that we will make sure that we will serve people wherever they decide to go. It is their choice to decide where to go, and when they will move, the United Nations and the partners that are working with us and coordinating with us will serve them where they are.
Okay. Stefano?
Thank you, Stefano Vaccara, Voce New York, Ital Press. A question on several countries, European countries, withdraw help to UNRWA a few months ago. Did you notice that since then that those countries, they are not funding anymore UNRWA, at the same time maybe compensating, giving somehow, some way, more help directly toward Gaza, or you didn't notice that? And in particular, if you did notice something like this by Italy.
Grazie, Stefano. So, in general, I would have to say that the support to the flash appeal, that is the humanitarian appeal that we have done for the response in Gaza, has been generously supported at unprecedented level. And I have to thank all the member states that have realized that is essential to keep sustaining humanitarian response. Which is a very expensive humanitarian response for the specificities of the operations in terms of security and constraints that we are facing that makes it particularly expensive. But I cannot relate, the transfer of funding against the flash appeal from funding that was originally intended to go to UNRWA, apart from some countries that have clearly declared so, that they are reducing UNRWA or cutting to zero UNRWA, and then they are reducing funding for other operations. I'm not aware of specifically Italian funding. I know that the Italians have contributed, I think, around 8 million euros in the second part of last year, between the second part of last year and the first part of this year, as of now, against the flash appeal, the humanitarian response. But I have no idea if this is money that was intended to go to England.
Last question.
Thank you very much. Yvonne Murray, RTE News, Ireland. You have painted a very bleak picture of the coming days and weeks, specifically when you talk about the possibility of running out of food and water in the coming days. That means that people will die as a result of that. This may sound like a morbid question, but I imagine you've done your own projections. What are you looking at in terms of people succumbing to this over the next few weeks? How many people will die in your estimation?
This is a complicated question. You know that one of the elements that is particularly challenging for us to in the path of the definition of famine or not is that it is very difficult for the entire system because of the fact that the health system has been completely dismantled or crippled to follow precisely the additional death or to have a precise data on the number of fatalities. So projection on death, we have not done those. And I really hope that we will not be in a position where we have to start thinking into this direction, because my work is to open up space for increasing humanitarian assistance and making sure that we save as much life as we can.
Thank you. I believe that's all the questions here.
I have a question, Farhan.
Okay.
I put my name for a question.
You're not on the. You didn't submit it to the list. Yes, Abdulhamid, please ask.
Thank you so much, Mr. Domenico. This is Abdulhamid Sayam from the Arabic daily Al-Quds Al-Arabi. Last time you spoke to us, you had been just out of Gaza. So if you can tell us when is the last time you've been there, and if you can describe to us your personal account of what you have seen in Gaza recently. The second question about the mass graves discovered in the hospital. There are calls even by the Secretary General to investigate that. How much you know about it, and if you can share with us what you know about the mass graves in the hospital. The Security Council is meeting this afternoon to discuss this tragedy. And from what you have said, sir, I think I will follow up with the same question. We anticipate mass killing in the next few days or weeks. Do you anticipate mass death of thousands of Palestinians if this situation is sustained? Thank you.
Thank you, Abdulalim. I was in Gaza 2 weeks ago for a quick visit. I have been in Khan Yunis for the first time since the end of the operations, and I was once again unable to recognize neighborhoods. The level of destructions that I've seen in some areas, in some neighborhood, is unimaginable. You know, roads do not exist anymore. Rubbles have been pushed against the first floor of the buildings. Shops have been systematically, hit by shelling and shooting. As you can imagine, sewage and water pipelines have been completely destroyed. You have frequently areas where there is sewage in open air. So it is undescribable, the level of destruction. It is amazing to see that despite all this, you have families and Palestinians going back to the remaining of their homes, even when there are a pile of rubble, trying to restart and to be next to their own places. On the mass grave, I think that unfortunately we have not been able to independently verify the situations. It has been very complicated also to bring in the right expertise and to deploy with the right equipment, the right expertise, because as you can imagine, it is very sensitive. It requires expertise that are very, very specific, and those have not been yet deployed to make sure that when they do the exhumation of the bodies, they also take all the details and the necessary tests that are necessary to account for who the persons are and so on and so forth. We have been told, and in some cases we were witnessing ourselves, in the case of Shifa, for example, cases where family members were invited to the excavation of the mass grave, and they were trying to recognize their family members by their clothes, their shoes, as any sign on remaining on the body that could help them to identify their loved ones, which is simply, humanly terrifying to think that we have to push people through this. So I joined the Secretary General asking for full investigations on those events, and that has to be done as soon as possible. As far as the potential implication of the Rafah operation and the impact on population, I really want to believe that reason will prevail, and we will find a different way to deal with the situation on the ground. The suffering that civilians population are subjected to is simply beyond our ability to describe with words. I've been asked frequently by many journalists to provide them images because there is not enough images coming out and not being present on the ground, which is utterly problematic. You don't have your own, apart from the brave journalists, Palestinians that have been sacrificing their lives since the very first day of the war. But simply something that will stay with me for my entire life, and I will try to do whatever I can to help people to go through this terrible, terrible period of their life.
Fine, thank you very much. And I think those are fitting words on which to end this briefing. Thanks so much for taking your time, Mr. De Domenico. Again, this was our guest, Andrea De Domenico, the head of operations for OCHA in the Occupied Palestinian Territory. Have a good afternoon, everyone. Good afternoon.
Thank you.
Bye,
Thank
Andrea.
you. Good afternoon.